I'm Johanna, and I'm in a group with Emma and Margaret, and we chose to talk about tendinitis. Tendinitis is an inflammation or irritation of a tendon, and a tendon is the fibrous cords that attach the muscle to the bone. And tendinitis is characterized by pain and tenderness just outside of the joint. While tendinitis can occur in any of the tendons, it's most common around your shoulders, elbows, wrists, knees, and heels. And some of the nicknames for the tendons are the swimmer's shoulder, jumper's knee, and golfer's elbow. So these athletes are just really known to overwork these tendons, which causes pain and inflammation. Then we have the symptoms. Pain is often described as a dull, achy pain, especially when moving the affected limb or joint. There's tenderness, mild swelling, feeling a crackling sensation when you move the tendon, a reduced RLM, which is the range of motion, and thickening of the tendon near the joint, and a formation of the lump on the tendon or irritated area. The most common cause of tendinitis is overuse. Some work-related causes are intense, repeated, and sustained exertion, cold temperatures, abnormal postures, and vibration. It commonly develops after doing repetitive work, a high workload, or pressure to complete work in a given amount of time. It also could result from a traumatic injury, strenuous exercise, or repetitive movement at a rapid pace. Some other causes are the posture, misalignment, defective body development, and complications from another disease process. And we will do an assessment on you. So we'll first take your history. We'll ask you about your normal and unusual exercise and activity patterns. We will determine if you have joint pain, swelling, and restrictive movement in one place. And then we'll ask you which joints are affected and if it has affected your sleep patterns at all. And then we will ask you if you have any history of musculoskeletal conditions or rheumatic disease. Then we will do a physical exam on you. We will see if the affected area is red, swollen, painful, and tender to the touch. And then we'll check for mobility restriction and the number and location of the joints involved. And then a psychosocial exam might be needed because we understand that you might be concerned with unlimited mobility and how it will affect your life and your work. We want to be there for you and support you along the way. And in order to diagnose tendinitis, we will look at the symptoms we already listed because these are the telltale signs of tendinitis. And often tendinitis can be diagnosed with just a physical exam alone, but we may do other imaging tests such as an x-ray on you just to confirm it. The goal of tendinitis treatment is to relieve your pain and reduce inflammation. Usually the first line therapy prescribed by doctors is medications. So we have the NSAIDs and the analgesics, which are the most recommended drugs, and these are both known to relieve pain and reduce inflammation. The physician may also prescribe immobilization using a sling, splint, or cast, and this is just to restrict the motion in your infected area to allow the injured area to heal. You may also benefit from physical therapy, but I encourage this after the pain subsides because we just want to strengthen and stretch the tendon in physical therapy, and that can cause pain if it's not fully healed. And then in rare situations, surgery may be necessary, but not in your case. And then often taking care of tendinitis on your own may be all the treatment you need. This includes rest, ice, and over-the-counter pain medications. I will also encourage you to elevate the affected area as often as you can to promote the drainage of the veins and decrease the swelling. Like I said, most cases of tendinitis can be successfully treated with rest, physical therapy, and medications to reduce the pain. Only the severe cases will need surgery. You may need to modify your lifestyle, change it, like your lifestyle or activities until the condition has improved. So I suggest avoiding activities that place extensive stress on your tendons, especially for prolonged periods. If you notice any pain, you're exercising, stop and rest. If one exercise,
Oh boy. Did this last time too.
yeah.
At least you're pretty much at this last year. It'll probably become more like brighter as we go. You're pretty much done. So if you want to finish, you can. You're pretty much
okay.
done, but that's okay.
And you can also go through like cross training, which helps you mix up the impact loading exercises, such as like exchanging running with biking and swimming. And just a final reminder to like listen to your doctor's instructions and follow the treatment plan we give you. And that's it. And these are our sources. So if you have any questions, just come up to me and ask me. Otherwise, you can go to these sources and they have more information.